Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. We're also happy to be joined this afternoon by all of our guests. We have London Mayor Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie, and the Medical Director at LHSC, Dr. Adam Dukelow. And a welcome to the media attending this afternoon as well. As always, we remind you that when you submit your questions using the question forum here on Microsoft Teams, if you could indicate your name as well as your media outlet and who your question is directed to. And finally, a welcome to you who are tuning in this afternoon, whether it's on Rogers Television, the Rogers, or tuning in on the CTV London. Let's get to the opening remarks right away, and we'll start with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. I'd like to start first by acknowledging today, International Women's Day. This year's theme is Choose to Challenge. And I hope each of us chooses to challenge biases, question stereotypes, and celebrates the achievement of women and girls around the world, including so many right here in London, Middlesex. Turning our attention now towards the pandemic, I can tell you one fine was issued to a restaurant over the weekend for having too many people seated at a table. Warnings were issued at other establishments, and because we're still in orange, the rules are clear: no more than 4 per table. Something else I'd like to highlight when it comes to law enforcement, as officers are attending malls, and in particular, they've noticed a growing trend of people not wearing their masks properly. At Masonville Mall alone, 16 individuals were warned. As Dr. Mackie, Dr. Dukelow, and others will tell you, wearing a mask under the chin does nothing to prevent the spread of COVID-19. At this stage of the game, there's really no excuse, because masks are not new. Everyone should know how to wear one safely and properly. The fine, by the way, for not doing this is $750. And I think you could do a lot of things with that. But frankly, the key is wear your mask. Beyond that, I think everyone is justifiably optimistic based on last Friday's news about updated vaccination timelines across Ontario. The vaccine rollout is really starting to ramp up, and many groups seem likely to receive their first shots much sooner than first anticipated. Having said it, while there's clearly light at the end of the tunnel itself is a long one. We're still months away from having a significant percentage of the population vaccinated, which means the time between now and then is still fraught with risk. We need to stay focused. We need to stay vigilant. We need to stay committed to common sense, public health, safety principles. It's why when something as simple as wearing a mask properly has seemingly become a challenge for some, we have cause for concern. Conversely, our recent trajectory gives me cause for optimism, especially compared to other medium and large-sized cities in Ontario. So let's be optimistic, and above all else, let's be smart. Let's be diligent. Let's continue looking out for one another. And that's it for me. Over to you, Warden Cathy.
Great. Well, thank you very much, Mayor Ed. And as the Mayor noted, today is International Women's Day. And so my remarks today are going to be focused on that. I continue to be in awe by the women that I am privileged to be surrounded by. This past year has been a challenge for all of us. And as it has been well documented, women have been disproportionately affected by the economic fallout of the pandemic as compared to men. And this is across Middlesex, this is across the City of London, this is across the province, this is across the country. The Women's Caucus of Middlesex have heard incredibly impactful stories from women across the county. And I have been at the same time emotionally touched, challenged, and angered by the stories that they have shared. And yet we endure. As we begin to think about recovery and in a post-pandemic environment, make sure that women are at the table sharing their insight in how a recovery will happen. Listen to their stories and their lessons. Learn from them. Going forward, these are the voices that need to be part of the recovery and the rebound. I was fortunate enough to attend an event hosted by the Lieutenant Governor of Ontario celebrating the 50th anniversary of the national status of women. And it was clear that we have come so far, but at the same time, there is still much work to be done. Women continue to have to work on balancing all the roles that we take on. Women continue to be judged on choices made. Women are still having to claw to find their equality. While social media has many positives, it has also opened another door where women can be easily shamed without consequence. And while I am surrounded by men who see me as an equal, that has not always been the case. And I can share stories of ignorance, and those stories would actually be fairly recent in time. I do not forget these interactions, but I don't let them define me. I am the mother of 4 boys, and I share these stories with them, hoping that they can be a changing voice when witnessing similar experiences. I am 57 years old, and I can say that I am comfortable with who I am and what I do. But that has not always been the case, and it has taken me some time to be able to say that. Please let it not be lost on the impact and difference that you can make as an inspiring woman in your corner of the world. I would be remiss if I did not take this opportunity to recognize our female frontline workers, whether in healthcare, emergency services, essential services, all the women who have continued to balance it all during this past year. Your strength and your resilience to what we have faced, what we continue to endure, is empowering. To all the women who will always challenge and inspire me, celebrate your beauty, power, and strength today. Over to you, Dr. Mackie.
Well, thank you very much, Mayor Holder and Warden Burghardt-Jesson, and happy International Women's Day to all. Some concerning signs over the past 24 hours. We had 27 cases reported yesterday, including 1 death. That's just the 2nd death we've had in the last 3 weeks, a reminder that COVID continues to impact our community. We also saw over 1,600 cases reported across the province yesterday. That's the highest number in about a month. So both of these local and provincial pictures suggesting that our counts may be beginning to climb again. That's obviously cause for concern and for all of us to double down on our efforts. There are a few things I want to point out today. We had a very unfortunate story about people going out to celebrate after they received their vaccine over the weekend. I want to be very clear, no vaccine provides immunity the day that it's received. It takes at least 2 weeks to have any sort of significant immunity developed. And in the case of the COVID vaccines, that exact same pattern is the case. You do not have adequate protection until about 12 to 14 days after your first vaccine. After that point, protection is good. Before that point, there is very little protection. So if people want to go out, for a meal to celebrate after receiving the vaccine, that's one thing, but they should not do so in the belief that they are instantly protected because of having received their vaccine that same day. A couple of things I'd like to point out about our vaccine booking system. We have adjusted the system to match the new clarity from the province that the eligibility for those 80 and above is not based on birth date, it's based on birth year. That means that anyone who was born in 1941 or earlier is eligible now to book through our local covidvaccinelm.ca website. So even if you haven't turned 80 yet, but you were born in 1941, you're eligible to book. So really hoping that folks in that category do so, as our system previously hadn't. I'm informed that as of about an hour ago, we still had 150 spots available for those that are 80 and above to book today. So please do make sure that you're getting out to book if you're in that category, or encouraging friends, family, loved ones, neighbors, etc. to do so if they are. That's it for me. For now, Dan, I'm happy to pass over to Dr. Dukelow to say some words on behalf of LHSC.
Thanks, Gary.
Thank you very much, Dr. Mackie. As always, I appreciate the opportunity to join this group and brief you on COVID-19 situation in our hospital. I will start, though, by adding to the others' recognition of International Women's Day. I have the privilege of working with so many amazing women every single day, healthcare professionals, leaders, community members, and patients. I'm pleased to report this is the 5th week we've begun with no active outbreaks of COVID-19 in our facilities. We have seen a slight rise of inpatients, though, unfortunately, from less than 5 last week to 9 as of today. Fortunately, we are still caring for less than 5 COVID-19 positive patients in our ICUs. As a result of all of our community's efforts to follow public health measures, London and Middlesex continue to do well from a case count perspective, with some of the cautious warnings, though, that Dr. Mackie just had. However, our healthcare colleagues to the east and west continue to be pressured. At this time, at LHSC, we remain focused on preventing outbreaks, maintaining our scheduled activities and surgical volumes, as well as managing the logistics of the vaccination clinic at the Agriplex with our health unit colleagues. We are keeping a close eye on those local, regional, provincial numbers such that we can pivot a response as needed. We are hopeful that our community is also remaining vigilant. We know that following public health guidance to limit social interactions, physical distancing, and wearing a mask has been the most effective way to date to keep London in the situation that it's in, of a relatively good one in terms of COVID-19. While the vaccination brings significant hope, even for those vaccinated within and outside our walls, it does not change the necessity, as Dr. Mackie just mentioned, for individuals or groups of individuals to continue to follow public health measures. Within the walls of the hospital, even though we're very grateful that many of our folks are getting vaccinated, we are not changing our practices and protocols based on that. If each of us continue to practice these behaviors, we can reduce the risk of seeing cases increase and again, avoid a return to the harsher measures we had a few weeks ago. Thank you again, and I look forward to your questions this afternoon.
Thank you, Dr. Dukelow. Thank you, Dr. Mackie, Madam Warden, and Mr. Mayor. Well, let's get to the questions, and I know we have a lot of them in the queue. So we'll start with one from Sean Irvin at CTV London. Dr. Mackie, this question is for you. Sean says, Dr. Summers touched on the variant case at Saunders this past weekend, but could you speak to it specifically and how concerned students, staff, and the public should be?
For sure. Yes, there was one of the student cases that tested positive for a variant of concern. Obviously something that we are watching closely. There's no change in the management of this situation. The steps we've taken to exclude the students, to make sure that they're tested, to make sure that we're monitoring the school closely for any further spread are the exact same steps, regardless of whether the COVID case is a variant or not. So from that perspective, it doesn't change a whole lot. The primary reason for notifying the school population and the public is really out of transparency. That said, we have seen a growing number of variants of concern over the past week or so in particular. 2 new today that we will be reported publicly tomorrow. We had a number come in over the weekend and a number late last week as well. So that's becoming a growing proportion. We're in the range of 20 to 30% of our overall cases that are testing positive for being variants of concern. Something, again, we'll watch closely and likely will have an impact in terms of the spread in the community.
Thank you, Dr. Mackie. Let's go to the next question, and it's a follow-up. How might those potential new cases impact any decisions related to keeping schools open?
Yeah, so the variants of concern doesn't change the public health management. It's still a COVID virus. It still spreads the same way, and it's still, the same public health measures are used to control variants of concern as any other variants. It is something that spreads more easily. So the primary thing to do is to double down on the efforts, make sure even more so than in the past that students in school are wearing their masks, keeping their distance, using the sanitizer, not coming to school if they have any symptoms, et cetera, et cetera. And that, of course, goes for all of us in the community, wearing our masks, keeping our distance, staying home when we can, and doing everything possible to avoid unnecessary, unprotected indoor exposures.
Thank you very much. Next question is from Jane Sims at the London Free Press. And Dr. Mackie, I think this one is for you. About the Saunders Secondary School variant case, why is it not on the health unit's dashboard on the school list? Also, my understanding is that positive tests are screened for a variant, but confirmation of a variant isn't made until the test is retested at a lab in Toronto. When was the Saunders case first detected? And if the positive test was more than a week ago, How concerned are you that the variant has spread throughout the school population? Should this be available immediately at Saunders? Lots to digest there.
Yeah, we have no concern that this is something that is spread through the school community. In fact, you know, almost all of what we're seeing in schools mirrors what we saw in the fall. Schools are a reflection of spread in the community. There is not much spread, if at all, in schools. These are situations where, because of all of the testing that is happening of students with symptoms, we're identifying cases that were primarily acquired elsewhere. The student is on the school list. The case was detected last week. The variants of concern, the secondary test, you're correct, it does occur in Toronto. That usually happens within 48, 72 hours that we get notified of the variant and concern status. It takes another week, sometimes more, to get the whole genome sequencing back, which is really the genetic footprint, fingerprint, which tells us whether the case is a UK variant of concern versus South Africa or the Brazil variant. So I think that covers most of the questions there. Jane, please do chime back in if I missed something. Thanks.
All right. Jennifer Beeman is next up, Dr. Mackie. Of the 9 new variant cases reported since Thursday, how are any connected to travel, and how many are linked to close contact with other variant cases?
Yeah, the variant cases we've detected most recently have not been linked to travel. These are locally acquired. So we know that the variant of concern is becoming an important factor locally. About 2/3 of our cases at this point have been linked, both variant of concern and others, to contact with a positive case. We're really seeing the number of contacts per case go up, which is a sign that people are gathering more indoors. Those are close contacts where people are unmasked, and that's exactly the sort of situation where we expect spread to occur. So it's once again a reminder to avoid close contact indoors without a mask.
Let's move away from the questions about variants of concern to another one from Jennifer Beeman. This one, Dr. Mackie, how many shots have been administered to seniors 80 years of age and older since the first day on Thursday? When does the health unit expect to have this target population complete?
Well, I can tell you that the bookings have slowed down, which means that the majority of those in 80 plus that are interested in getting vaccinated right now have done their bookings. So we are encouraging anyone left to please do come out and get those shots, so that once we're ready, we can move on to the next population. We are also expanding our eligibility within the very high priority healthcare workers at the moment. And sometime over the next 2 to 3 weeks, we hope to be able to add additional age groups in terms of into the eligibility queue as well. The eligibility will stay open for anyone that has ever been eligible, 80 plus, healthcare workers, whatever it is. We won't miss people. If they want to get shots, they still will be able to book. But we will have additional groups that are added soon. In terms of the number of people 80 plus that have been vaccinated since Thursday, the ballpark figure would be in the range of 2,000 to 3,000. That's on top of the thousands that were vaccinated through the long-term care retirement home campaign in January, February, which continues, and where second doses will be completed very soon. Overall, in terms of bookings, we have booked or vaccinated somewhere in the range of 20,000 people over 80, and that'll be a huge dent in terms of getting that population vaccinated. There are roughly 30,000 of the people of that age group in our catchment area. One thing that is a factor that still will take some time to tease out is the residence of all of those individuals. We know that there are a small number of individuals that are coming, well, a large number that are coming from the southwestern region, which is the sort of St. Thomas, Elgin area. We also know that some people come from further afield to seek vaccination in that 80 plus population. So the reporting capacity we have doesn't currently tease that out. So we'll have more information on that over the next few weeks.
Thank you, Dr. Mackie. Jen has another question. Dr. Mackie, the health unit reported 27 new cases today, the most in weeks. We've had several deaths in recent days. 1 week into loosened restrictions, are you concerned about the trajectory of cases in the Middlesex-London area?
Well, I think that there is cause for concern. I think that we've seen increases locally and a big increase yesterday provincially. We know that our pattern tends to follow the provincial pattern. So all of that is concerning. Now, that said, we aren't seeing the huge spikes that we did in December, January of the past few months. And we're well off our peaks, but and really it's a race now. Can we get enough vaccine into arms so that we really are able to weather this, what seems to be coming, which is a third wave, without having an excess number of deaths?
Thank you, Dr. Mackie. We're going to move to, I know Jen's got a couple of other questions and we will get to those, but I wanted to move along to a couple of other questions. Matthew Trevithick at Global News Radio, AM 980 CFPL, has a question for you, Dr. Mackie. He just wants to confirm your comment that upwards of 30% of local cases right now involve variants of concern. Yeah, that's really depending on the date, but over the past week or so, we have seen a range of around 20 to 30% of cases as variants of concern, which is a huge increase. I mean, the previous couple of weeks we were down in the 0 to 5% range. So that's definitely a significant development, and is part of why we're seeing our case counts climb again. And a follow-up from Matthew. Dr. Mackie, do you have any updates on the opening timeline of the next 2 vaccination clinics? Also, do you have any comments regarding some of the vaccine news from last week, including the Johnson & Johnson news, and how that might impact things locally? Well, on the timeline of opening those additional vaccine clinics, we do hope to have at least one, if not both of those, open by the end of this month. We're still working on finalizing those opening dates. We won't necessarily have dramatic increases of vaccine supply by the end of the month, but we do plan to be ready for when those vaccine supplies increase dramatically, which we believe will occur in April. The Johnson & Johnson announcement on Friday is helpful. It does add another source of vaccine to our country and to our community ultimately. The other announcements that have happened more recently will be more impactful in the shorter term. We're going to see a significantly increased number of Pfizer vaccines coming into Canada, into our community, Moderna as well, and then the AstraZeneca vaccine shortly after that. So all of that together is great news from the perspective of vaccine access, and will mean that we're able to open additional clinics and potentially additional routes for the vaccine to be delivered beyond even the mass vaccination centers. Thank you, Dr. Mackie. Back to a couple of questions from Jennifer Beeman. This one is for you, Dr. Mackie, and also for Mayor Holder. So Mayor Holder, why don't we start with you? With the return to Orange, is the health unit or City Hall receiving complaints of non-compliance or stepping up enforcement? And I think we talked a bit about that, but Mayor Holder, I wonder if you had some more comments there.
Thanks very much, Dan. I can't speak to from the perspective of the health unit, but from the standpoint of the city, as we've moved to Orange, I'll be candid, the response has been one of relief from the standpoint of both the public and the business community. I mentioned in my earlier comments the issue around the challenges where people congregate, and one was the mall where warnings were given, and the other was a restaurant that was somewhat ambitious by having more people at a table than they should have, and it's very clear what the requirements are, and that particular restaurant was fined. So in terms of complaints, no, in fact, it's gone quite the other way. But again, people are trying to be vigilant, and at the same time, they are being attentive to others. Anecdotally, I can tell you stories of individuals who are, as more people congregate in settings like stores, where people will say in a vegetable department, stop touching all the fruit, or in the case of other areas. I mean, that sounds cute, but it's quite true. I mean, we still have to maintain that sense of vigilance and perspective. So people are calling out others' bad behavior as well, and I think that's appropriate. At the same time, we ask that people do it respectfully, and so I will tell you, I think the move to Orange was welcome news by the city, and both from a business and a personal perspective.
Thank you, Mayor Holder. Dr. Mackie, do you have any extra comments to add there?
Not much, Dan, and I mean, certainly if the warden wanted to comment as well. Our primary enforcement right now, because of our longstanding relationships inspecting those facilities, is with restaurants, and we really have not had much come through in terms of public complaints around those facilities.
Thank you, Dr. Mackie. And yes, I was going to come to Warden Burghardt-Jesson. How about in the county or in your municipality of Lucan? Are you hearing about any of those complaints for non-compliance coming in?
Well, thanks very much for that, Dan. No, I am really not. People were so, I think, grateful for the opportunity to move into Orange that, they're really not taking the chance of having that taken away from them. So we're not seeing and not hearing complaints. I have to be honest, most of our complaints are dealt with the OPP, and I haven't had an update from them this week. But certainly my past correspondence with them has indicated that there hasn't been any sort of uptake from them with complaints as to gatherings and that sort of thing. People are very grateful that they can now go out to our local restaurants, albeit, in smaller groups, and restaurants are just happy to have people in the doors. And I think they're doing everything that they possibly can to not have that taken away and not take a step backward.
Thank you very much, Madam Warden. And the next question from Jennifer Beeman is for Dr. Dukelow. So we're going to complete our round around the table here. Dr. Dukelow, is London Health Sciences Centre doing anything to discourage long lineups outside of the Agriplex? Are people arriving too early for their vaccination appointments?
Thanks, Jen, and thank you, Dan. So there are some folks that are arriving early for their appointments, and that's not to lay blame on those individuals. We are asking folks to show up no more than 10 minutes in advance of their booked appointment. And there are other items in place that are helping manage those lines, such as an app or a notification for waiting room management using the parking lot, but not everybody uses that app, which is okay as well. But like anything, this is continuous improvement. It was just the end of last week, we went from 1,000 doses to, I believe, 1,300. And with that, we're bound to see some lineups that require us to course correct, and the team is working on that as we speak.
Thank you very much, Dr. Dukelow. Next question is from Elan Peterson at the Western Gazette. Dr. Mackie, are there any new cases associated with the Essex Hall outbreak? If so, how many?
Yeah, we haven't had new cases recently there. The close contacts of those first few cases were tested. We had 52 test results come back, all of those coming back negative. So at this point, it looks like it's a fairly focused outbreak at this point.
Thank you, Dr. Mackie. Next question for Mayor Holder from Jennifer Beeman, again at the Free Press. Mayor Holder, why were the 16 maskless people at the mall warned and not fined? Will City Hall continue to step up enforcement at malls in the coming weeks?
Well, thanks, Jen. Look, the city feels that we should start with education before enforcement, and charges ultimately become the last resort for those who don't comply after warnings. With respect to stepping up our enforcement at malls, I'll say that the City of London is going to be quite vigilant, both at malls and at facilities and locations where people congregate. And warnings always, enforcement with fines as necessary.
Thank you very much. And our final question for this afternoon comes to us from Andrew Graham at Global News Radio, AM 980 CFPL. Dr. Mackie, this one is for you. Dr. Mackie, what's needed before the health unit can expand the general population age eligibility for vaccines locally?
Yeah, so there are a few things to consider. First of all, making sure that we have left as much eligibility as we need for those groups that are already eligible. We need to keep some spots booked for those who may have had trouble booking or may have been, unavailable to book earlier. Second of all, we need to make sure that we have moved through enough of that population. Third, we are looking constantly at who and how other health units are moving forward. There's a real risk of being out of step, and we really want the system to move forward together. It doesn't do anyone a service if one population is much more highly vaccinated than another population. We know that what spreads elsewhere will come here and vice versa. So we need to make sure that our neighboring health units and others across the province are moving forward adequately. Not that we would hold back from vaccinating anyone. We are literally vaccinating as quickly as we can in our community, but we certainly have transferred vaccine to other regions in the past when we had excess supply and they needed to catch up. So that's the sort of thing that we would look at. And then beyond that, we do want to make sure that our system is adjusted appropriately. We've had some good success with balancing the phone line and the online reservations recently by reserving some of those appointments for phone lines so that we can get some people who aren't able to access appointments online vaccinated and into the clinics. So that's moving fairly well. We've also updated in the process of updating the vaccination booking system online to make it much more user-friendly, and we should have more information about that available Thursday.
Thank you very much, Dr. Mackie. And we got, that does it. That takes care of our questions for the rest of the afternoon, the rest of today's virtual media briefing, which is now complete. We want to thank you for joining us once again. We will be back with our next virtual media briefing on Thursday afternoon at 2 o'clock. We hope you can make it. So between now and then, have a great rest of your Monday afternoon. We'll see you on Thursday. Take care.